911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
So the study presented here today was looking at the combination of panobinostat, bortezomib and dexamethasone. We treated 46 patients at the Royal Marsden with this combination. They were very heavily pre-treated population, so on average they'd had a median of 5 lines of therapy before they had the pan-VD treatment. We found that the progression-free survival in this group was 3.5 months and the overall survival was 7.8 months in our patients. This is kind of in keeping with using other therapeutics such as pomalidomide in this context, so in such heavily pre-treated patients. The main kind of toxicity we saw was cytopenias, so a lot of our patients, the majority of them, had to have either blood transfusions or platelet transfusions during therapy. So kind of in conclusion, I think pan-VD is an option for these very heavily kind of pre-treated patients, but still we don't have a long progression-free survival and we need to think about other therapeutic agents. I think it's really difficult. I mean, the first thing we say is these sort of, in the UK at the moment, what we can use is we can use panobinostat, we use pomalidomide, and we can also sometimes use bendamustine at these kind of 5th or 6th line therapeutic options. What we would say is try and get patients onto trials. Whatever trials is the most important thing, because we know that patients do better if they are enrolled into trials. But I think with such heavily pre-treated patients, it is difficult, and we're just going to be looking at what drugs we use kind of earlier on and newer therapies and immunotherapies and seeing if that can benefit these patients as well. So a lot of these patients that have had multiple lines of therapy can come to the clinician already having cytopenias. They can be anemic, they can have low neutrophil counts, low platelets, which makes kind of treatment difficult. They might be frail and old if they've gone through multiple lines, so you need to think about medications that they can actually take. So if you think about IV infusions, sometimes if someone's quite frail, they can't keep coming up to hospital for these infusions. So I guess pill-based tablets are often really convenient for people, and things that have low side effects as we want for everybody. We now have in multiple myeloma multiple classes of drugs that we can use, and this is really booming, but I guess it's just being able to use these in people that are frailer, older patients, and again, getting people into trials and getting them up to hospital enough to receive these medications.